Hey everybody, my name's Weston Pugh, and over the past 2 years I've been a counselor and a coach for cancer patients and their caregivers. And over that time I've gathered a resource kit of various tools that have been used to support folks both as patients and caregivers on their journey in relationship to cancer. And so I wanted to take just a few minutes here to present some of those tools, to share them with the larger community in hopes that they can be of support with folks that are facing a cancer diagnosis in their family or in relationship to themselves and their own health. And with that being said, I also want to just first acknowledge the pain and the suffering and the challenges that come with the cancer diagnosis. And of course, I wish that these themes and these tools that I'm going to be covering in this video, I wish they could take away that pain and the struggles. And of course, they can't. But what they can do, I believe, is offer some support to help make the journey a little bit more bearable. So with that, let's go ahead and dive into these 10 tools. And if you like anything that you hear in this presentation, go ahead, subscribe to my channel. And over the next couple weeks and months, I'm going to be uploading new videos that address each theme and topic individually. So you'll be able to go deeper into the themes and topics that really resonate for you along the path. So with that, let's dive in. And the 10 themes and tools that we're going to be addressing are as follows. So the first is going to be tending grief and changes in relationship to identity. The second one is going to be 4 levels of self, looking at the mind, heart, body, and soul through the cancer journey. The third one is the 3 values of containment that can support folks staying in right relationship to their experience along the path. Next is going to be working with the imagination, a bridge to both the nervous system and intuition. The next is going to be tending the foundation, safety, strength, and groundedness along the way. The 6th is keeping perspective local. The 7th is interrupting unhealthy narratives and patterns of rumination. The 8th is grounding into gratitude, awe, and kindness as a resource to self. The 9th tool and theme is story and community as medicine. And lastly, we're going to do a little exploration around the idea and theme of grace. The first topic and theme that I want to look at here, I call tending grief, navigating shifting identities. So cancer changes the structure of our relationship with others and ourselves. Now, in any big change, right, something dies within our identity and also something new is born. So we really want to give the space that necessary to ourselves for the grief process. Because once that diagnosis hits either ourselves, a friend, or a loved one, right, there is automatically a change. And as the experience continues to unfold through treatment and life after treatment, or for some, treatment becomes the new normal, life changes. And with that change comes a shift in how we relate to ourselves and others. And part of that change for folks who have been diagnosed means maybe they can't do certain physical things that they used to be able to do that were sort of core aspects of their identity. Maybe folks can't cook dinner anymore, for the family, or can't drive the kids to school, right? Or can't go hiking up in the mountains or play their favorite sports that they used to do, that was sort of a source of their own connection to their identity, but also a source of connection to others. So with that loss, right, it's very important to take the time to grieve what has been lost. Now, on the flip side of that too, we don't want to just pay attention to what's been lost. We also want to look for, what are the new insights, the new discoveries. What are we learning new about ourselves? What are the new resources that we're having to take on that support a deeper understanding of ourselves in relationship to our lives and the world? So there's many different tools and practices that we can bring to bear here to really support the grief process. There is journaling, artwork, nature connection, meaningful conversation with friends, support groups, right? All of these, and there's a couple other tools that we're going to talk about later in this presentation, but all of those tools are designed to open up spaces for reflection, for mourning what's been lost, for gaining new insights around what is showing up in your experience. So, giving yourself the time to really sit with that grief and listen to it. Deep listening is a tool in the grief process that is really necessary as a way of sitting with the grief and letting the grief really guide you, right? So there's an element of this where if you can sort of surrender to the grief, it can help show you the way through this process. So again, anytime there is change, anytime we're going through big chapters of change in our lives, our identity changes. We lose certain things and we gain certain things. And so this theme and topic, right, is really about sitting with what's being lost, but also paying attention to the new ideas, insights, perspectives, relationships, understandings that are showing up at the leading edge of your experience here, and tools to help this reflective process, right? Journaling, conversation, artwork, movement, nature connection, prayer, meditation, right? All of these are tools to support that process. The second theme and topic I want to explore here is the 4 levels of self: mind, heart, body, and soul. So it's important as we move through this process that we want to be tracking our experience on these 4 different levels, right? So the mind, the heart, the body, and soul. If we keep all of those levels of self in mind, then what you're doing is you're tending a holistic experience, and you're making sure that you're really in alignment on all those levels, which support circulation in your experience, right? And if you think about the definition of a healthy system is defined by circulation. Dis-ease, right, is sort of the first sign of an unhealthy system, right? Stuckness, emotional stuckness can lead to anxiety, depression, spiritual stuckness, mental stuckness, rumination, physical stuckness, all of inflammation, right? All of these are the first sort of signs and symptoms of unease, of dis-ease, which leads to problems in our health down the road. So in navigating stressful experiences such as cancer, we want to be promoting circulation in all of these levels of self. So the first level I want to look at here is the mind. And we can think of the mind as the stories and the narratives that shape our identity. So are the stories that you're telling about where you're at and where you're going and even where you've been, right? Are those supporting a feeling of safety, groundedness, and connection in your experience? Or are they causing you to withdraw? Are they activating a fight-flight response in your experience? Are they making you feel stuck and claustrophobic? So starting to catch the stories that you're engaging with in your mind is a practice to start to make sure, as it's really a practice of working with the nervous system, right? So let me give you an example of how we can work with narratives here. So one narrative that sort of represents a narrative of what I would call withdrawal or isolation is somebody who's received a cancer diagnosis. They're in treatment or they're going through treatment, and the narrative is, I can't do what I used to be able to do, so I'm worthless, right? I'm a burden, I'm worthless, right? That narrative triggers their nervous system into fight, flight, or freeze. It also makes them sort of withdraw, right, from friends and families, and withdrawal sort of from the world, right? So another way to sort of reframe that narrative, right, or another narrative that is in a way similar but has a different effect on the nervous system, which is one of connection, is I'm in a tough spot right now and I'm going to let myself lean on others. Right? I'm in a tough spot right now, and I'm going to let myself lean on others. Right? So that narrative still is recognizing the difficulty of the situation, but it's giving the person permission, self-permission, to lean on others, to ask for support, to ask for help. Right? And that narrative promotes connection. That narrative promotes relational understanding. Right? And that narrative signals to the nervous system, yeah, we're in a tough spot, but we're going to be, connected to other people. We're going to be asking for help. We're going to be in relationship. So tracking those narratives is really important. That's a way of tending the mind in a healthy way, right? Story is a form of nourishment to the body, right? Think of story as medicine. Right? We want stories that help the nervous system come into an open, resting orientation in the body so that we can relax, so that we can heal, so that we can rejuvenate, so that we can be connected to our resources, our creativity, our problem solving, our imagination. All of those come online when our nervous system is open and receptive. When we're telling sort of negative stories that isolate us, stories that cause us to withdraw, then we're signaling to the nervous system that something's wrong, and that puts us in this fight, flight, freeze response. We lose connection to our resources. And that puts us, that triggers the stress response in our experience and makes it hard to be in that place of healing, makes it hard to be in that place of relationship and connection both to ourselves and the world. So tending healthy stories, right? So a journaling practice here is to write down what are the stories that you catch yourself over the course of a day telling yourself about who you are, and where you're going. Which of those stories are helpful to you? Which of those stories promote connection? And which of those stories maybe aren't supportive in your process? And then the next step is how could you potentially reframe those stories so that they could support a little more connection and openness in your experience. So that's the mind, right? So then the next level is the heart level. I think of this level as the parts level. acknowledging and honoring the different parts of ourselves, the different emotions, and the sort of the complexity of our experience. And the idea here with parts work is that we want to honor the complexity of what we're going through, right? We want to honor the challenges, the fear, but everybody gets a seat at the table, right, in parts work, but the idea is that nobody gets to monopolize the conversation. So we want to listen to the fear, we want to listen to the anger, we want to listen to the despair, but we also want to listen to the gratitude and to the beauty and to the feelings of hope that also might be present in our experience, right? Because they all have something, all of these different parts of our experience have something to offer. But again, we want to understand and welcome the whole picture. We want to understand and honor it all, right? Without letting any one voice within monopolize the conversation. So an exercise here is just to journal, like, what are the different parts of you? Like, what are they saying about your experience, right? Well, a part of me is feeling a lot of fear, a lot of anger. Another part of me is feeling a lot of gratitude for how I'm showing up for myself, how others are showing up for me, right? Another part of me is feeling a lot of sadness, a lot of grief, a lot of loss. And another part of me is feeling a lot of hope. So again, honoring the complexity of your experience, honoring all of the parts, letting them all have a seat at the table, right? And making sure nobody monopolizes the conversation. And with parts work, it's important to kind of create space in your day to address and honor the parts, right? So whether it's 5-10 minutes in the morning or in the evening or midday, just taking that time to sit down and recognizing what's up for you, recognizing the fear, being with it, not trying to fix it or get rid of it, just listening to it, honoring it, recognizing the gratitude, right? Just recognizing whatever's up for you, giving it time and space, and then getting on with your day, right? Once you've done the process of listening and recognition, then you can move on and sort of compartmentalize these parts, tuck them away in a healthy way, right? Compartmentalization can be unhealthy, but compartmentalization can be very healthy, right? As long as we've done the work of witnessing and honoring those different parts that we're sort of putting away when we need to go show up for other people, or when we need to go to work, or when we want to just go hang out with friends and have a good time, right? But if we don't do that work of honoring, tending, witnessing all of those voices inside, then they can come out sideways in our experience when we least expect it. So that's the level of the heart, that's the level of parts, right? And then parts really connect us to our bodies, because our emotions come to life in our bodies, not necessarily our minds, in our bodies. So the work of the body is really, it's what I think of as naming and claiming, right? So when we're doing that parts work, when we're sitting with fear and sadness or grief or joy and gratitude, we want to name the feeling that we're having, and we want to place it in our body. So I'm feeling overwhelm and I'm feeling it in my stomach, right? So I'm going to sit with that overwhelm, and I'm going to try to be as specific as I can with my naming, because that helps the brain process the experience, right? This is called emotional granularity. We want to be as specific as we can connected to what we're feeling, because that helps the brain process our experience. So we want to name it. We want to name the experience we're having it, and then we want to claim it in the body. So I'm noticing this overwhelm. It's a combination of anger and sadness, and I'm feeling it in my stomach, right? And then we want to just sit with it. We want to honor it. We want to take a few breaths with it. We're not trying to change it. We're not trying to get rid of it. We're just trying to get into right relationship with it, right? And by not judging it, by meeting it with curiosity and compassion, right, then it can release. It knows how to heal itself in a way. It's looking, these emotional experiences are simply looking towards us and looking from us, looking for us to give them attention. And once we've given that part of ourselves attention, it works itself out, right? Then we can kind of get out of the way, and it processes, it circulates through the body. So a great tool here to really support that process in the body and with these parts comes from Tara Brach, and it's called RAIN, and it's an acronym. It stands for Recognize, Allow, Inquire, Nurture. And I'll put a link to a little article in Guided Meditation in the description of this video, so you can find that there. You can get more resources through that link. But RAIN is basically just what I described, where we're recognizing how we're feeling, naming it, claiming it in the body. We're allowing whatever is there to be there. Wow, I'm feeling a lot of anger. Okay, I'm going to just allow it to be there. I'm not going to judge it, because if I judge it, then I'm coming into conflict with what's arising in my experience. And that just drives stress, overwhelm, disconnect, anxiety. Those can all be products of conflict in our experience when we're judging or fighting or resisting something in our experience. So going to recognize it, going to allow it, going to inquire into sort of where it is in my body and what it needs, what it's connected to. Okay, this is connected to, I've got a scan coming up, or my partner has a scan coming up next week, and I'm noticing some agitation that is actually fear, right? So then the N is to just nurture it, right? So we're just going to sit with it. We're going to give it that compassionate awareness, right? But if you can't get to compassion, the first step towards compassion is just allowance, just witnessing it and being with it, right? So that's a great meditation for kind of that level of the body, right? And then there's this deeper level, that's the soul spirit level. And this is the level that, you know, we all need to define on our own what spirituality is, what soul and spirit means to us, right? But I think of it as sort of this ineffable sort of undefinable quality of the human experience that's unique in a way to each of us, and we kind of have to do our own work around it. But it's a huge resource for us in these big moments of change, like moving through a cancer diagnosis, through treatment, and everything that comes after that. So again, it's a level, everybody defines that, what that level sort of means to them on their own, but there are doorways in that we can all access to get into that space. So certain practices such as gratitude practices, creativity, prayer, poetry, beauty, nature connection, ceremony and ritual, right? These are just to sort of name a few. All of these sort of get us out of the analytical mind and drop us into this deeper place of feeling, of being in relationship to the mystery and miracle of life, right? And from that place of humility, of openness, of awe, right? New ideas, new perspectives, new understandings, new resources can come in that can support us on our journey moving forward. So again, as we're moving through this experience with cancer, either in ourselves or supporting somebody who's going through this process, we want to be looking at these 4 levels of self: mind, heart, body, soul, and bringing these various resources to those levels to really making sure that we're tending circulation on all of these levels, which helps us to then not get stuck, to be present, to be in right relationship to what is arising in our experience. So topic number 3 that I want to address quickly here has to do with the 3 values that I associate with this idea of containment. Containment is what we want to bring to our experience to help promote that idea of circulation. And it's seen in the RAIN process. I talked about it a little bit through RAIN, recognizing and allowing what is showing up. Now, sometimes we can have an experience of sadness, anger, despair, right? And we can judge those feelings. And then, as I said, as we judge those feelings, we're coming into conflict with our experience. Oh, I'm sad again. I'm angry again, right? And then we get stuck in conflict with what is arising in our experience. So these three values of curiosity, allowance, and non-judgment help us to orient us in right relationship to what is arising. And when we're in right relationship to our anger, we're allowing it to be there. We're getting curious about it. What does it need, right? We're recognizing it. We're allowing it. We're doing that work of RAIN, of inquiring into what it needs and then giving it what it needs. The power of curiosity, right, is that we can't be curious and judgmental or defensive or critical at the same time. So curiosity, allowance, non-judgment, these keep us in an open orientation in our nervous system. And when we're rooted in curiosity, then we're a half a step away from all these other resources: confidence, courage, calmness, empathy, compassion, creativity, right? And we need all of those resources to have productive communication when we're feeling stress, to have those tough conversations with loved ones about what we need for care or what somebody else might need for care when facing a cancer diagnosis, right? So these values for containment, right, they create a containment that allows the confusion, the sadness, the anger, the despair, whatever it is, to come up, to be held, to be witnessed, and to not totally overtake us, so that we then blend with these emotional experiences, and then we move from openness into constriction. And when we move into that constricted place in our nervous system, right, the first signs of constriction are judgment, criticism towards self or others, or defensiveness, right? Those are the first signs we're moving into a closed nervous system, which then activates the fight, flight, freeze response. When we move into that place of constriction, we lose our resources, right? And we blend with those, that we blend fully with the fear, we blend fully with the anger, we blend fully with the sadness, and we lose our lifelines that help keep us sort of nimble and agile as we're moving through what can be very stressful emotional experiences or environmental experiences that we're going through, that require agility, flexibility, empathy, understanding, right? So again, the work here is just moving through your day, right? And just checking in with yourself. Where am I at with my curiosity right now? What am I noticing? Can I be curious about that? Can I be curious about that story that keeps playing in my head, right? Can I be curious about that feeling that I'm noticing in my stomach, right? Can I allow it to be there, right? Can I not judge, like, am I judging or shaming a part of me or my experience right now? And if I am, can I move back into allowance for that experience that I'm having? Can I move back into, and from allowance, again, we're a half step away from compassion, right? Can I bring that allowance and compassion towards myself? Or maybe we're noticing something in the person we're caring for that's really grating us, or the person that's taking care of us that's really grating us. Can we come back into allowance and get curious about why that behavior might be showing up, and from that place of curiosity maybe have a conversation that's coming from not a judgmental place, but a place of curiosity and care that allows for a deeper intimacy to arise in the conversation. So I just wanted to put a pin in those three values and really invite you to bring them with you through your day, to accompany you through your day, to help keep you anchored into that open, rooted nervous system where you have that accessibility to all of those resources that can support you through your day. So with this next theme and topic, I want to explore the resource of the imagination, which I feel is one of the most underrated resources that we have in our toolkit as we navigate any sort of challenge in our lives, as we navigate healing our relationship to our history, as we navigate growing into fuller expressions of ourselves as human beings, right? The imagination plays a key role in all of this. So it's important to just name the imagination and claim it as a tool for ourselves. And note that the imagination works in two different directions, right? So in one direction, I think of it as going down and in and influencing our nervous system, right? And this is where visualization, which I'm going to talk about in the next segment here, really becomes a powerful tool for us for cultivating a sense of groundedness, safety, and connection in our experience, which is super important when we're navigating the cancer journey, which is riddled with uncertainty, right? And anxiety connected to what's the next scan going to say, how am I going to handle treatment, what are the side effects going to be, right? So tapping into the imagination to help regulate the nervous system is super important. But so that's that down and in energy. And part of the power here of the imagination is that our nervous system has a hard time deciphering reality from the imaginal. And we see this in the fact that our nervous systems get dysregulated when we're watching movies, when we're reading stories, right? When we're daydreaming. I can think about running into a bear in the wilderness and I can feel my heartbeat increase. I can feel my breath get more shallow, right? And I can think about sitting at the beach and taking in the sunset, and I can feel my breath being able to go deeper into my body. I can feel my heart rate begin to slow down a little bit. I can feel my whole body settling and relaxing, right? And this is the power of the imagination, right? Its ability to really affect change in our nervous system, which really affects change in our whole sense of perception and awareness. Now, so that's the down and in movement of the imagination. But then there's this up and out where we can use the imagination to tap into sort of our higher self knowledge, our intuition, right? We can visualize meeting maybe our 80-year-old self, our future self, and have these imaginal dialogues that might yield new ideas, insights, and perspectives for us, that might help us to make really challenging decisions by tapping us into a sense of an intuitive knowing around what might be best for our own care or the care of a loved one, right? So I just wanted to bring up the imagination and really name it as a tool. We're going to go more into how we can work with it later. But I just wanted to sort of bring that forward now and really underline that, because as I said before, I think it's a very underrated resource that we have in our toolbox when navigating really difficult situations. So now we're going to be moving on to topic number 5, which is tending the foundation, safety, strength, and groundedness, right? So moving through the experience of a cancer diagnosis, of treatment, of recovery, a core theme in all of that is uncertainty, right? So when navigating uncertain, choppy waters, we want to have resources that can connect us to a sense of safety, of groundedness, of strength, that can really operate as guides and tools for ourselves to support our journey moving forward. So there's 3 tools that I want to bring up here that can really help us tap into those feelings of safety, strength, and groundedness. The first is breath work, right? So breath work is a bridge into our autonomic nervous system. It can help us to calm down, but it can also help to energize us. So if we find ourselves in a fight-flight response, feeling stress, feeling overwhelmed, feeling agitation, right? Maybe we're thinking about, again, maybe the next scan or what's going to happen a few months from now. And we, the stories that we're telling ourselves are getting us worked up. The imagination is being used in a way where it's activating ourselves. Then we want to come down, use the breath to anchor us back into the body, into the here and now, which is the safest place to be, right? So taking really deep breaths, making sure we're breathing into the belly, and on the exhale, bringing the belly in towards the spine. On the inhale, out, right? And just that regulation of breath. You can do a box breath, which means, it's a 3 or 4 or 5 count in, hold it for 3, 4, 5 counts, breathe out 3, 4, 5 counts, right? That can just help bring your breathing back into a more regulated space that can help bring you out of the fight-flight response. Another great technique to help calm you, to bring you out of that sympathetic fight-flight response and into a more regulated response that invites the parasympathetic nervous system to come online, which is that place of resting, relaxation, digestion. So breath that invites that awareness to come in is it's an extended exhale, which is pretty much what we do when we sigh, right? It's just that feeling of and that sigh, that extended exhale, is a signal to our nervous system that we're okay, that we're in the clear, right? That we can relax, right? So if your breath in is a 3 or a 4 count, doubling it on the exhale. So in 1, 2, 3, out 1, 2, 3, 4, 5, 6, resting, back in a 3 count, out in a 6 count, right? Or in a 4 count, out in an 8 count. So working with that breath is a great way to get into the autonomic nervous system and help to bring the heart rate down, help to get you back in the body. Or if we're feeling sort of numb and checked out, then a circular breath can help to bring energy back into the system, to bring us back into the body in a way that feels sort of energized and back into the scene and the situation again. So for circular breathing, we're just going to go we're just not pausing at the top and we're not pausing at the bottom. And again, that's for moments when we're kind of stuck in maybe more of a freeze response or a disassociated response, right? Maybe you've got some bad, and we all tend towards, some of us tend more towards the freeze response, others of us tend more towards maybe the high, overwhelmed fight-flight response. So just tracking where you're at. Maybe you get in a fight with a partner that makes you sort of check out. You get some bad news, you check out, you go numb, right? Doing that circular breathing is a way to just bring circulation back into your system, to get back into the body. So the next tool here for tending that feeling of safety, strength, groundedness is the visualization, right? So I like to pair visualization with deep breathing, right? So when we're feeling dysregulated, you can imagine something that gives you a feeling of calmness or safety, right? For me, it's thinking about roots coming out of the base of my spine, connecting me to the earth, right? And then I'm just going to imagine like those roots again kind of coming out of the base of my spine, stomach area, and I'm going to breathe into that space in my body, right? So I'm connecting my breath, and I'm bringing that in, I'm using that image, that visualization. For some people it can be like a beach scene or some sort of scene in nature. Well, put that scene in your stomach and use your breath like you're breathing in to that scene to activate it. So it's encouraging. We're working on the level of the imagination here to activate a feeling of what I call resonance, a felt sense of safety or strength or connectedness. And we're also integrating the breath here too. So we're bringing two tools together here to create that feeling of rootedness, of safety, of connection, to be here now in the moment. So again, the breath and the visualizations can be a way to create that feeling, that felt sense of safety, that felt sense of strength, right? And so just working with whatever image that elicits that feeling in your nervous system, right? So that's working with visualization. Another really powerful visualization is called the ideal parent meditation. This was developed by Daniel P. Brown and his work at Harvard, supporting folks with really deep sort of attachment wounds that they couldn't access from talk therapy because it was sort of precognitive, pre-memory wounds that they couldn't access just through thinking about it. So they had to develop a meditation, right, that basically allowed people to create a new attachment map that made the old map obsolete. So people would imagine these ideal parent figures, ideally suited to them and their needs, coming in and bringing that person exactly what they needed in the moment, right? And so this can be a powerful tool when we're feeling really worked up and we can't soothe ourselves, right? Maybe we feel that sadness and we're so overtaken by it, we're so blended with it that we can't give it that curiosity, or we're so angry we can't give it that curiosity or that containment. Here you can use that ideal parent meditation, right? Or maybe it's a spiritual figure that you're connected to that comes and that supports you in that imaginal space, that gives you that support, knows exactly what you need. And again, I'll put a link to the ideal parent meditation in the notes here. But again, that figure knows exactly what you need, and it gives you that sense of support that helps the nervous system to come into a really grounded place, that helps you to come back into that state of regulation. So again, working with breath and visualization, imagining safe places that feel good to you, imagining ideal parental figures that know exactly what you need and can soothe you in the ways that you're exactly needing in the moment, or spiritual figures that can come in and give you exactly what you need in the moment, right? Or mentors, whatever. Whatever, it's just all about feeling that sense of support that can help ground the nervous system, that signals to the nervous system, in this moment we're safe, in this moment we're okay, right? And again, that's the power of the imagination. The imagination has that ability to tap us into those spaces of and feelings of safety, connection, groundedness. So, theme and topic number 6, keeping perspective local. One of the constants in the experience of cancer, whether it be for yourself or if you're a caretaker tending somebody else who has cancer, right? A constant through the experience is uncertainty. How do we learn to live with uncertainty? On one level, uncertainty haunts us all in life and is a reality that we get really good at sort of denying. And so we create various defenses psychologically that help us to sort of keep the reality of uncertainty out of our awareness. But then cancer comes and smashes all of those defenses. And it makes us live with the reality of uncertainty on a daily basis. So I have kind of come up with this term of the importance of keeping your perspective local, because ultimately the safest place to be is in this moment, right? If we start to spin out our minds too far into the future, the more macro we get, the larger out our perspective goes around the future, thinking a month out, 6 months, where am I going to be 6 months from now? Where am I going to be a year from now? Where's my partner going to be? Where's my child going to be, right? The less of a feeling of control that we have, and the more activated our nervous system is going to get, right? So keeping our perspective local is about living in the moment, living in the day, living in the week, at most living in the month, right? Because we can sort of plan out where we're going to be tomorrow. We can get a feeling and plan out kind of where we're going to be next week or a month from now. But really much beyond a month, it becomes sort of, we don't really know. We can't really say. So the closer to the moment that we can live and be in, the more of a sense of control that we have. The more of a sense of control we have, the more rested, grounded, and open our nervous system is going to be, right? So the work here is to track when you're zooming out too far, right? When you're feeling that anxiety, is it, where are my thoughts right now? Am I thinking about 6 weeks from now? Am I thinking about 6 months from now? And if I am, and it's causing me a lot of anxiety, then I need to bring it back down into this moment, into the day, into the week, where I have much more of an ability to control what's showing up in my experience and react to it. So that's a little bit about the importance of keeping your perspective local, being here in now, in the moment, as a way of giving your nervous system that sense of control that helps it feel, that helps keep it regulated. So the next theme and topic I want to address is number 7, which is interrupting unhealthy narratives and rumination, right? And this, in a way, it connects to the level of the mind, the stories that we tell ourselves. It connects to imagination and how imagination can drive narratives and stories if we're not being conscious of it. It also connects to keeping our perspectives local, and it connects to how those stories influence our nervous system. So when we are maybe lost in the future, right, telling in narratives of what if this, what if that, or we can be lost in the past around narratives connected to regret, right? These narratives, one way to work with this, to not get lost in the narrative and have the narrative further drive emotions that then drive the narrative in a stronger way, which creates a feedback loop that we can think of as rumination. So to break up that cycle of what if this, what if that, this idea of in cognitive behavioral therapy, they term catastrophizing, thinking about the worst case scenarios, getting stuck in sort of this catastrophization mode, right? Or getting stuck in the past around certain maybe regrets or decisions that we made connected to this or that. We want to, rather than getting lost in those narratives, which really drive an emotional response that turn into moods, right? And I was just reading research the other day that was talking about how an emotion only takes a minute and a half to work through our nervous system. But when we put a story on top of that emotion, it turns into a mood. And a mood can last an hour, it can last an afternoon, it can last a week, a month, or a year, right? So interrupting the narrative is a way of getting out of the story and dropping down into the emotion that's driving the narrative, right? And this is where rain can be powerful. This is where containment, bringing curiosity, allowance, non-judgment can be powerful. When we find ourselves getting lost in those narratives, right? Think about what is the emotion driving the narrative, right? What's the emotion driving the catastrophization, right? What's the emotion driving the what if this, the what if that? Oh, it's fear. Oh, it's sadness. Or a fear of loss, right? What's under this feeling of this story of regret around this? Oh, it's disappointment. It's unprocessed grief, right? So we can use that. There's data in the stories, in that the stories are trailheads that point us down to the emotions that are what really needs our attention. So the invitation here is, when you find yourself getting lost in a narrative that might be that you might be ruminating on, right? It might be creating an emotion that then drives the narrative more, right? We want to drop down into the emotional space. What's the emotion driving the narrative, right? And then we can bring rain to it. We can bring curiosity to it. We can name it and claim that emotion in the body. We have all the tools that I've addressed in sort of the other segments here, that we can bring to tend that emotion, which will then depressurize the narrative. Because once we've tended the emotion, then the narrative loses its energy. We're no longer caught in the narrative, because we've depressurized the emotion that's driving the narrative. So that's an important skill that we want to work with. And part of that skill is just, again, tracking the stories. When we notice these stories that are driving our nervous system into constriction, fight, flight, freeze, right? What's the emotion under the story? And tending it in a way that allows that emotion to circulate, which breaks us out of the narrative. So, topic number 8, grounding into gratitude, awe, and kindness. Gratitude, awe, and kindness have been shown in research as key pillars of psychological health and well-being. So we talked about grief in the first theme and topic, right, related to grief and identity, making sure we really carve out time and space for ourselves to mourn what has been lost in this change with the cancer diagnosis of towards ourselves or a loved one, what has been lost in our identities, what has been lost physically, what's been lost relationally, right? But we don't want to just dwell in that, right? We want to honor it, we want to tend it, we want to help it move into circulation. But there are other resources that can help us make sure that we don't get lost in the morning, right? And these resources of gratitude, awe, and kindness can help us sort of keep one foot on the ground so we can do that deeper work of mourning and grieving. And that deeper work of mourning and grieving also carves out more space for gratitude, awe, a recognition of the importance of kindness, of service in our lives, right? So gratitude, right? There's sort of two levels of gratitude. One is sort of a more abstract gratitude where, I can be grateful for my parents, even though they're not in the room with me right now, right? I can be grateful for my son, even though he's not with me right now. So gratitude is about thinking about, those things in our lives that nourish us, that we appreciate, right? And gratitude grounds us. It has a grounding influence on our nervous system. So it's a beautiful tool to pull on when we're feeling like we're moving up into that fight, flight, freeze response in the nervous system. It pulls us back down into the moment, right? And there's another level of gratitude which is connected to savoring. It's not as abstract because it's about what's happening here, now, and in the moment, right? Savoring the beautiful plant on your windowsill and how the sunlight's moving through it. Savoring that cup of chai or coffee that you're drinking in the morning. Savoring that beautiful conversation that you're having with your friend, or the beautiful sunset that you're witnessing, right? Savoring, again, brings us into the moment. And often the moment is the safest place that we can be. So the next, right, gratitude, now awe. Awe is another resource for us. I think of gratitude as this down and in, this anchoring energy. Awe is more of an up and out energy that connects us to the mystery and miracle of life. It situates us in a place of healthy humility. The Greater Good Institute at Berkeley has done a lot of work on awe and the role of awe in tending healthy psychological well-being. So check out Greater Good. They've got amazing podcasts that don't just talk about awe, but also talk about gratitude, kindness, service, everything that I'm talking about here. So awe, right? It gives us a feeling of being small. That's in a way, it's a healthy feeling because it cultivates a healthy humility where we hold our beliefs a little lighter. It helps us to empathize with the other in a little bit easier way. It keeps us open and oriented towards the beauty and the wonder and the miracle of existence, right? So that is medicine for our mind, heart, body, and soul. Another key pillar here of psychological well-being is connected to kindness, right? Sometimes we need a break from our own experience, right? Sometimes being kind, right? Serving the other is a way of getting a break from our own mind, right? The stories that can trap us so often and make us feel constricted, right? Bringing flowers to the nurses, bringing cookies into the hospital, right? Bringing gift cards to our friends that are bringing meals to us, right? Staying connected to kindness is a beautiful way to get us out of ourselves and support the world around us. So again, 3 tools here that are resources for the journey, for tending that healthy psychological well-being, that can help us do that, sort of keep us grounded so we can do that deeper work of grief, right? Of mourning, right? Gratitude, awe, and kindness. Theme and topic number 9, story and community as medicine. The stories that you tell carry power, carry energy, carry medicine, right? But it's super important. Well, first of all, it's important to tell your story, right? That's why support groups are so powerful, because they offer places for both caregivers and patients to share their story, share their struggles, share their successes. Story is medicine for others. Hearing somebody's story is medicine for us, right? Being witnessed in telling your story is medicine for you, but you offering your story to others is medicine for them. And we also want to be really careful about who we tell our story to. Some people aren't ready to hear our stories. Some people can't hold our stories, right? So it's important to have discretion, right, in who you're sharing your stories with in relationship to your experience with cancer, either as a patient or as a caregiver, because some people can't hold it. And if you tell your story to somebody that can't hold it, it loses its power, it loses its medicine. You walk away not feeling good. But if you tell your story to somebody who can hold it, it grows in power. Its medicine grows. It's not just medicine for you by telling your story, but it becomes medicine for the person receiving the story. So this is just an invitation here to have discernment around who you tell your story to. Because if you tell it to the right people, that energy, that medicine grows. It's a healing process for everybody involved, right? But not everybody's ready to hold and hear these stories or certain details within the story, right? So there's some discretion that's needed there and some discernment, right? And again, that's why spaces like support groups are powerful, because often there are peer facilitators that know how to hold stories and handle storytelling, or there's trained therapists there that can hold a really solid space. But also, right, telling our story to friends, to community, right? This is an ancient ritual. This is an ancient ceremony that is absolutely essential in the healing process and in you staying in right relationship to yourself and your own process. By not sharing your story, you're staying isolated, right? And that isolation isn't good for your nervous system. It's not good for your health. It creates stress. But by sharing the story, you're getting that weight off your chest. You're bringing that story into circulation, into community, where as long as it's in the right space, it becomes medicine for community. So that's the power of story and community as medicine. So the last theme and topic I want to touch on tonight is really an inquiry into this idea of grace. In a way, for me, it's an effort here to bring you into an inquiry with your own definition and understanding of grace. It's a word that shows up organically a lot in my own coaching and counseling sessions in relationship to cancer. How do we navigate the pain, the obstacles, the uncertainty, the suffering connected to cancer? How do we navigate that with grace? One of the core themes that accompanies a cancer diagnosis is uncertainty, as I talked about earlier. And one emotional experience that we associate with, that's associated with uncertainty, is fear, right? An antidote to fear is trust, right? When we can trust our resources and we can trust ourselves, then whatever is coming around the next corner, we can trust that it might not be what we want, but we can trust that we can navigate it. We can trust the resources we have, the tools, the support network that we have to navigate whatever is coming around the corner. And when we can trust, an extension of trust is faith, right? And perhaps out of faith, grace arises. Grace arises despite fear. Grace arises despite uncertainty, right? Grace arises perhaps when our 4 levels of self, the mental, emotional, somatic, bodily, soul, spirit levels, are engaged, when we're open, when we're receptive, when we're curious, right? When we're in right relationship to our grief, but when we're also in right relationship to joy, kindness, awe, wonder, right? When we can hold it all and bring it all together to inform a fuller experience of being human, maybe grace arises out of that. Maybe grace arises out of that, and maybe grace is something that supports all of that. I don't know, but those are just some thoughts that I wanted to bring in here, because it's a resource that is important for us to be in relationship to through the question. We're not trying to solve what grace is or means. We're not trying to define it, but just by asking the question, I think we're inviting it we're inviting it to be in conversation with us, and for us to be in conversation with it as a resource in our experience. So with that, I want to close with this poem entitled Fear by Khalil Gibran. It's said that before entering the sea, a river trembles with fear. She looks back at the path she has traveled from the peaks of the mountains, the long winding road crossing forests and villages, and in front of her she sees an ocean so vast that to enter there seems nothing more than to disappear forever. But there is no other way. The river cannot go back. Nobody can go back. To go back is impossible in existence. The river needs to take the risk of entering the ocean, because only then will fear disappear. Because that's where the river will know it's not about disappearing into the ocean, but of becoming the ocean. So thank you all for being with me in this presentation. I want to just conclude by sharing a few resources, but just to sort of recap what we've gone over, right? We've explored 10 tools here connected to grief and changing identities, tending the 4 levels of self, mind, heart, body, and soul, 3 values of containment, curiosity, allowance, and non-judgment, the power of the imagination, tending the foundation, cultivating safety, strength, and groundedness, keeping your perspective local, interrupting unhealthy narratives and rumination, gratitude, awe, and kindness, resources for the journey, story and community as medicine, and last but not least, grace. So I also want to share some resources that might be helpful for you. One is Cancer Lifeline, which is an organization based out of Seattle that I do counseling work with. Also, I offer some programs, teaching programs through Cancer Lifeline, but it's an incredible resource. They offer support groups that are free and classes that are free for people all over the world within the cancer community. Another great organization is Cancer Care in New York State. They also offer counseling and resources for folks that live within New York State. And lastly, Healing Circles Global, which is an organization that trains people to run circles in their own communities, sort of peer-to-peer circles in their own communities for the cancer community, for people that have a cancer diagnosis and for their caregivers. These are safe spaces to come and witness and be witnessed. It's medicine that is stirred up through community, community that shares the cancer journey in common, and it's medicine of witnessing and storytelling. So I encourage you all to check out their incredible work as well. And lastly, you can find out more about my work at pathways-to-resilience.net. If you would like to, if you have any questions about this presentation, you can reach out to me at westonpugh@gmail.com, or you can also set up a free consultation with me at pathways-to-resilience.net and find out more about my work through there. So thank you for tuning into this. I hope you found one or two things useful that you can put in your back pocket and take with you on the journey that lies ahead for you. And on that journey, I wish you grace.